Qué buena experiencia. Hi, I'm going to talk about pembrolizumab plus chemotherapy in metastatic non-small cell lung cancer. Definition: first-line therapy for advanced non-small cell lung cancer that lacks targetable mutation is platinum-based chemotherapy. Among patients with a tumor proportion score for programmed death with a tumor proportion score for programmed death ligand of 50% or greater, pembrolizumab has replaced cytotoxic chemotherapy as the first-line treatment of choice. The additions of pembrolizumab to chemotherapy resulted in significantly higher rates of responsible as longer progression-free survival than chemotherapy alone in a phase 2 trial.
We conducted a randomized phase 2 trial in advanced non-squamous non-small cell lung cancer looking at standard chemotherapy, pemetrexed carboplatin combination with or without pembrolizumab. So one of the new PD-1 inhibitors that already has an approval in the second-line setting in individuals with 50% expression or higher of PD-L1. Our trial randomized roughly 123 patients. They were stratified but not selected for PD-L1 status. So any PD-L1 status was allowed. That PD-L1 status was blinded to the individual participants and their physicians. And the primary endpoint was response rate, and if that was positive, then progression-free survival. And in fact, we hit both primary endpoints. Response rate was nearly double, 55% compared to 28% for the control group. And we saw more than a 4-month improvement in median progression-free survival from 8.9 months to 13 months for the pembrolizumab combination. Survival currently is virtually identical. It's still very early. Plus, there is crossover in the control arm to pembrolizumab. So,
Application in medicine. Lung cancer is the leading cause of cancer-related death worldwide. Platinum-based chemotherapy with or without maintenance therapy, and subsequently followed by second-line cytotoxics, followed by second-line cytotoxic chemotherapy, is a standard treatment for most patients with advanced non-small cell lung cancer, with a median survival or approximately year.
My presentation at ASCO 2018 plenary session is on Keynote 42, which is a clinical trial comparing pembrolizumab as a single agent versus chemotherapy as a single modality in patients with non-small cell lung cancer with both squamous and non-squamous histology who did not have EGFR mutations or ALK translocations and who had not yet received treatment for advanced or metastatic disease. In this trial, we randomized 637 patients to each arm, and we had overall survival for the whole trial population and for the groups with 20% and above and 50% and above PD-L1 expression using the tumor proportion score. And of course, the whole trial population had a tumor proportion score of 1% and above. We did not enroll patients without any PD-L1 expression, and what we did show is that overall survival was better for the whole trial population as well as for the groups of 20% and above and 50% and above. In addition to that, we also looked at toxicity for all patients, and patients who received pembrolizumab had fewer adverse events than patients who received chemotherapy. When we looked at severe adverse events graded between 3 and 5, we saw that only about 17-18% of patients with pembrolizumab had those events versus approximately 40% of patients who received chemotherapy.
PRAS. Treatment of stage non-small cell lung cancer. Neither chemotherapy nor radiotherapy is necessary, so treatment with pembrolizumab may be an option as a first treatment. Treatment can be done by radiofrequency. Ablation may be another option if the tumor is small and is at the outer part of the lung. Cons. Pembrolizumab showed modest toxicity. Treatment-related seriously adverse events of grade 3 or greater severely were observed in less than 10% of patients, a portion that is lower than that anticipated with chemotherapy.
The excitement now is with the approval of a regimen of chemotherapy, in this case carboplatin and pemetrexed, with pembrolizumab. So this is a regimen that's already been explored in a study called Keynote 021G. Dr. Corey Langer presented and published these data earlier in the year. And now we have an approval in the first-line setting for patients really regardless of PD-L1 status who just have advanced disease, newly diagnosed, and of course non-squamous non-small cell lung cancer. So this is a big step forward. We had pembrolizumab for about a quarter of our patients with PD-L1 high expressing tumors, and now we have a regimen that's available for really all patients regardless of PD-L1 expression. So this is a big step forward, probably the first of several we'll see over the course of the next several months or years, where we're going to be seeing other chemotherapy regimens with other checkpoint inhibitors, atezolizumab combinations, nivolumab combinations. So more to come, but this is a big step forward in the care of patients with lung cancer.
Issue applied in Ecuador. In Ecuador, the statistics compiled by the Ecuadorian Institute of Statistics and Census show that in 2013, malignant tumor caused 191 deaths. To this is added that, according to the Ministry of Health, mortality from cancer in Ecuador for the male population occurs most frequently from cancer of the stomach, prostate, trachea, bronch, lung, liver, bile, blood, and colorectal. For the female population, mortality is due to cancer of the stomach, cervix, breast, and liver. Given this scenario, immunotherapy treatments are an alternative. Surgeon oncologist Raoul Oliens, a specialist in French, points out that it is one of the most far-reaching strategies in the fight against cancer. He adds that this technique is already used in this country.
In 2018, we are in the year of the first line for advanced non-small cell lung cancer, because we have multiple possibilities of treating patients with immunotherapy in first-line treatment. And here in Chicago, we had several updates of, for example, the Empower trial, which was already presented before in December. But we have two important trials. One is the Keynote 189, and the second one is the Checkmate 227.
Conclusions. In patients with previously untreated metastatic non-squamous NSGLC without EGFR or ALK mutations, the additions of pembrolizumab to a standard chemotherapy of pembrolizumab and a platinum-based drug results in a significantly longer overall survival and progression-free survival than chemotherapy alone.
My name is Anthony Rivas. I'm a professor of medicine at UCLA and I'm the director of the tumor immunology program at the Johnson Comprehensive Cancer Center. The original objective of this clinical trial was safety of a new drug called pembrolizumab. As the study was conducted, the objective changed to assessing early evidence of anti-tumor activity. This paper reports on a phase 1 expansion of pembrolizumab, a first-in-class anti-PD-1 blocking antibody that unleashes immune responses to cancer. This clinical trial started as a cohort of patients with metastatic melanoma being treated with pembrolizumab at a certain dosing regimen of 10 mg per kilogram every 2 weeks. After the first 30 patients were entered, there was evidence of anti-tumor activity in a significant number of them. So the study was expanded to up to 655 patients to better assess the dosing regimen and anti-tumor activity. In this clinical trial, pembrolizumab had an objective response rate of 33%. This is in all patients entered in the study, which tested 3 dosing regimens of pembrolizumab. There was no difference in the dosing regimens. In patients who were previously untreated with metastatic melanoma, the response rate was 45%. Out of the patients who had an objective response, the majority of them maintained the objective response. At 1 and 2 years, 75% of the patients continued to respond. The median overall survival in the whole population was 23 months, which compares favorably to what was known of the median survival of metastatic melanoma to any other prior therapy. 14% of the patients had grade 3 or 4 toxicities, which are clinically significant adverse events. The majority of those side effects were managed by temporarily stopping the treatment or giving symptomatic treatments. Only 4% of the patients had to stop the therapy because of adverse events. This clinical trial led to the approval of pembrolizumab based on a breakthrough status designation by the Food and Drug.
Thank you so much.